Well, good afternoon, everyone, and welcome back to our daily update. Today, we're going to start with the medical update from Dr. Ezike. Doctor?
Thank you, sir. Good afternoon. Thank you, Governor. And we will jump right into the numbers. We have a lot of information to share with some special guests, so I'll keep my comments ultra brief. Today, we are reporting a total of 36,934 cases, which includes the 24-hour increase of 1,826. We're reporting, unfortunately, 123 fatalities, which brings our Illinois total to 1,688 lives lost in the fight against COVID-19. Right now, statewide medical surgical bed availability remains relatively flat, similar to ICU bed availability. Although use has been increasing slowly, capacity has also been increasing, thereby maintaining relatively stable levels. As of yesterday, 4,877 individuals were in the hospital were reported to be hospitalized with COVID-19. Of those, 1,268 patients were in the ICU and 766 patients were on ventilators. We continue to encourage everyone to stay at home, to wear masks when outside, clean frequently touched surfaces, and look out by helping neighbors and elderly people by trying to drop food off on their door or do other neighborly activities. Thank you for continuing to stay all in for Illinois, and with that, I will turn it back over to Governor Pritzker. I've actually forgotten the Spanish update, apologies. Buenos tardes. Hoy tenemos mucha información, por eso yo voy a ser muy breve, porque tiene muchos invitados especiales. Hoy IDPH reporta un total de 36,934 casos de COVID-19, un aumento de 1,826 casos desde ayer. Desafortunadamente, hay 123 muertes adicionales. Eso causa un total de 1,688 personas que han perdido la lucha contra COVID-19. Desde anoche informó que hay 4,877 personas en Illinois que estaban en el hospital con COVID-19. De ellos, 1,268 pacientes estaban en la unidad de cuidados intensivos y 766 personas estaban en ventiladores. Esos números son difíciles oír cada día y por eso debemos mantener el rumbo en que estamos. La lucha contra COVID-19 sigue. Tenemos que luchar juntos. And now I will turn it over to Governor Pritzker.
Thanks, Doctor. And I'm pleased to be joined today by Nigel Goldenfeld, the director of the NASA Astrobiology Institute for Universal Biology, leader of the Biocomplexity Group at the Institute for Genomic Biology, and a professor at the University of Illinois Urbana-Champaign. Sergey Maslov, UIUC professor of bioengineering, who is also at the Institute for Genomic Biology, as well as the National Center for Supercomputing Applications. Dr. Toyin Adeyemi, an infectious disease expert with decades of experience at Cook County Health, where she directed the core hepatitis clinic and was senior director of HIV services for the health system. Brad Cole, executive director of the Illinois Municipal League, and Cameron Mock, the chief of staff to the Governor's Office of Management and Budget. Professors Goldenfeld and Maslov are here representing the entire modeling group that I convened weeks ago, the members of which have been dedicated to developing the best possible modeling and analysis for Illinois' battle with COVID-19. These are some of the best experts in the entire nation, and we are very lucky to have them advising us. To start, let me explain a bit about the role of modeling in my decision making. Since the outbreak of COVID-19, I've taken into consideration a variety of models from researchers all across the world. There are often widely different projections from those about the state of Illinois. Some of this disparity is the result of methodological differences, but much of it also is due to data access and quality. The earliest coronavirus models that we had in the United States had to rely upon data from other countries applied to our national landscape. And certainly there was a real benefit in those very early days of getting educated estimates of what the virus's effect on Illinois would look like, regardless of where that early data came from. But the picture that gets painted by modeling gets better when it's based off of what's actually happening on the ground in Illinois, data that can only be gathered with the passage of time. We now have what we didn't have 2 months ago, an understanding of what COVID-19 cases, deaths, hospitalizations, ventilator and ICU usage look like every day in Illinois. Even so, 2 months is not a lot of time in the world of modeling. That's important because the very essence of a model is that it gets smarter over time. How? Well, you consistently test past predictions against current reality and then adjust projections accordingly. Or to put it simply, the more facts that you have, like exactly how many people went into the hospital with COVID-19 on a certain date, the better your ability to predict outcomes on any later date. Notice I say it becomes better because it never is exact. There is no crystal ball available to us. There are only estimates. Illinois is the proud home to some of the finest researchers and research institutions in the world. And still, it is always the case that different modeling teams come to different conclusions. So I undertook a project to give me the best possible approximations of future COVID-19 illnesses in Illinois that would then allow me to make decisions about what resources we would need to keep Illinoisans alive and recovering, and what urgency would be required in decisions about whether to initiate new mitigation strategies or extend existing ones like the stay-at-home order. I have known from the start that even the best projections are going to have a great deal of variance, but knowing the boundaries of that variance informs my decision-making. So we convened top researchers from the University of Illinois Urbana-Champaign, the Chicago and Illinois Departments of Public Health, Northwestern School of Medicine, the University of Chicago, and we also brought in outside consulting groups. They worked as a cohort under Civis Analytics, using the most comprehensive data available for the entire state of Illinois. Suffice to say, the findings we're discussing today about the state of Illinois were put together by some of the best scientists, doctors, researchers from some of those great institutions that I just mentioned. I want to look first at the projected fatalities. As you can see from the graphs that are next to me, Illinois is now looking at a peak or plateau of deaths per day somewhere between late April and early May. Why a range instead of an exact date? Well, everyone wants to look at the median line as a guide, that nice clear line that cuts through the big shaded section on all the models circulating online. But reality is not quite so simple. Look at the actual deaths from the past few weeks on the graph next to me and look at the median projections going forward. Reality swings up and down, sometimes drastically, a fact that can't be captured with a simple median line. What we have to consider is the whole shaded area. That shaded area shows the range that researchers are 95% confident that things will land. That's a shaded area you would see, in differing shapes on every model. To be clear, the fact that the variance is large doesn't make a model less useful, but it does nevertheless make it clear that it is only a tool to be used. I worry that people think the model is some miraculously accurate view into the future that is going to tell us exactly what we need to do and when. It's not. It won't. I guarantee that the model that we're sharing today will change in the coming days as projected numbers about those days are replaced with actual numbers. A model is an imperfect tool that we use to add context to the actual numbers that we can chart every day: cases, fatalities, hospitalizations, positive test results, ventilator and ICU usage. I also want to explain a bit about this change in our estimated peak cases. The concept of flattening the curve only just entered our common vocabulary in the last few months, and it's really crucial to understand our approach. Weeks ago, many models, both those produced by our in-state experts and those from around the nation, predicted an early or mid-April peak for Illinois. But as the weeks have progressed, those models have come to look quite different. That's not because those models were bad models. Instead, it's because their inputs got better as time went on. Real-time data came in, and importantly, Illinoisans protected each other by staying home. Human behavior is exceptionally difficult to measure and even harder to predict. So that last part about staying home has made all the difference in our progress. Also, and this is very important, the most sensible and responsible use of a model in a public health crisis like this one is to pay close attention to the worst case scenario. In other words, when building hospital beds, purchasing and acquiring PPE and ventilators, and making decisions about mitigation efforts, public officials should assume that the worst end of the model range could happen and take that into account in planning. A pushing out of our estimated peak is a natural consequence of, it's a natural consequence. Pushing out that peak is a natural consequence, and the best indicator that we are flattening the curve. That's what you're aiming to do: slow down the rate of transmission, which leads to a slower rate of increase over a longer period of time, hence a later and lower peak. Pushing the peak further down the line might not sound like good news, but I promise you, it saves lives. And make no mistake, Illinois has saved lives. By staying home and social distancing, we have kept our infection and death rates for the months of March and April thousands below the rates projected had we not implemented those mitigation strategies. The good people of this state have allowed our healthcare professionals the ability to treat patients to the best of their ability without having to make dark choices, very real choices that doctors in other countries faced about who lives and who dies. That is a historic and heroic act carried out by all of you. Your efforts to protect your families, protect your communities, protect each other have also given us another tool, and that's time. Time to build up our hospital capacity in terms of beds, ventilators, and healthcare workers. Time to prepare for the kind of surge that could occur any time as a result of a virus from which no one is immune. And capacity we built. In August of 2019, back in a world that had never heard of COVID-19, Illinois had an average of about 26,000 total hospital beds available. As of today, our total bed count in existing hospitals is more than 31,000. Back in August, we had about 2,000 ventilators. That number is now more than 3,200 ventilators. And we're building our healthcare workforce too. There are now 5,000 out of out of state and former medical professionals who have applied for temporary licenses to join Illinois' fight against COVID-19. We've built up our hospital capacity significantly, but if we let up now, we would have nowhere near the kind of hospital capacity that we would need. The projections are clear. If we lifted the stay-at-home order tomorrow, we would see our deaths per day shoot into the thousands by the end of May, and that would last well into the summer. Our hospitals would be full, and very sick people would have nowhere to go. People who otherwise might have won their fight against COVID would die because we wouldn't be able to help them through. No amount of political pressure would ever make me allow such a scenario for our state, our beloved state of Illinois. So the numbers present us with only one choice. Next week, I intend to sign an extension of our stay-at-home order with some modifications through Saturday, May 30th. To everyone listening, we are in possibly the most difficult part of this journey. I know how badly we all want our normal lives back. Believe me, if I could make that happen right now, I would. But this is the part where we have to dig in, and we have to understand that the sacrifices that we've made as a state to avoid a worst-case scenario are working, and we need to keep going a little while longer to finish the job. On a more optimistic note, my team and I are finalizing the next step principles for safely moving toward reopening in phases. We are making progress building out testing and launching our contact tracing initiative. So that is so important to us that over time we will be able to realize the new normal, and we can be ready. We'll be sharing more on that in the days and weeks ahead. On another optimistic note, May will look somewhat different than March and April. Since implementing our original stay-at-home order, I've listened to Illinoisans across the state and elected officials of both parties and business leaders, and I've continued to consult with doctors and scientists and experts here in Illinois and across the world on how best to keep our people safe. My intention, as always, is to put your health and safety first as we make some practical adjustments based on what we've learned in the first 5 weeks of the stay-at-home order. The new and modified executive order will take effect on May 1st, and I want to lay out some of the changes that we've made for you now. Because we are bending the curve, surgery centers and hospitals will be able to begin scheduling surgeries that had been delayed so that we could maximize statewide capacity for COVID patients. Facilities will need to meet specific criteria, including proper PPE, ensuring enough overall bed and ICU availability, and testing of elective surgery patients to ensure COVID-19 negative status. The Illinois Department of Public Health is issuing exact specifications to healthcare facilities statewide, based on the idea that we need to make sure we have surge capacity. We're allowing some elective procedures to resume for the benefit of patients and our hospital systems, but make no mistake, the first priority for our healthcare system continues to be the health and safety of all Illinois residents. That means preserving bed capacity for COVID patients no matter where they come from. As I've said before, we value all lives equally, and that includes the men and women in our corrections facilities. If we find out that hospitals are refusing to live up to their obligations, the director of the Department of Public Health has the authority to investigate and enforce this policy and will not hesitate to do so. Also, starting on May 1, retail stores that are not currently on the list of essential businesses may take orders online and over the phone and offer pickup and delivery. We've made it more explicit that greenhouses and garden centers may remain open with specified social distancing measures in place. We will begin a phased reopening of some of our state parks under the guidance of the Department of Natural Resources for activities such as hiking and fishing and boating with no more than 2 people. Social distancing must be maintained in all activities. We're also strengthening some of the public health measures in the order to limit the spread of the virus as much as possible. Starting on May 1, any individual over the age of 2 and able to medically tolerate a face covering or mask will be required to wear one when in a public place where they can't maintain a 6-foot social distance. Face coverings work, and we need all Illinoisans to do their part here. For our essential businesses, including manufacturers, we're issuing new requirements on social distancing and new caps on occupancy. Again, all of these things won't take effect until May 1, a week from tomorrow, and they are only minor modifications, what we can do safely, while keeping our stay-at-home restrictions in place as we manage through this next phase. I know that even with these changes, this stay-at-home order leaves many restrictions in place. And in the coming weeks, as we get to the point of working our way down to the other side of the peak, as we move forward, there will be more to do to get people back to work and open up even more. Understand that these are not choices that are made arbitrarily. These changes are what the data says that we can offer the people of Illinois without risking so much viral transmission that our hospitals will again become or potentially become overrun. That said, if we start to see crowds and people violating the order or breaking the rules, I will need to bring back these restrictions. I'm hopeful that we will not need to do that. Folks, this is a battle that you never asked to fight. I know that. I also know that our doctors and our nurses and our healthcare professionals never asked to lead us through a pandemic. Our essential workers never asked to man the front lines of society. Our small businesses never asked to sacrifice their bottom line to an invisible enemy. I see your pain, and I am so very sorry for it. But for every person who wants to go to dinner or hang out with friends in a park or swing open their salon doors, there is a family mourning the death of someone they love. There is a parent, a child, a friend who would give anything to have their greatest strain be the difficulties of staying home and not the unimaginable pain of a life lost too soon. I'm not in the business of comparing suffering. In a pandemic, everyone is allowed to hurt. But we have the opportunity to prevent the pain of loss from touching the lives of thousands. We have the opportunity to follow the leadership of the countless nonprofits and community leaders and families across Illinois who have demonstrated their courage and their empathy and their willingness to help. Illinois has the best people in the world, and I've said all along that I will fight like hell for you. I'm asking you to hold on for just a little while longer to help make sure that we all see through to the other side of this struggle. One day I pray that this virus will be a memory, but the strength that we found together will be something that we carry with us forever. Thank you, and now I'd like to turn it over first to Professor Nigel Goldenfeld and then to Professor Sergey Maslov to discuss the work of our modeling group. Professor.
I would like to thank Governor Pritzker not only for his strong leadership, but for making my job easier in explaining to you the task of the modeling groups. So let me tell you a little bit about modeling, but in my own language. Modeling an epidemic is rather like modeling the trajectory of a rocket when you don't know where it started from, in what direction it was pointing, and how much fuel is on board the rocket. and you can't even see the rocket. Modeling an epidemic is not rocket science. It's harder. Once the epidemic is sufficiently far along that respiratory cases appear in hospitals, its origins are untraceable. In the case of COVID-19, many people get infected, but only show weak symptoms, or sometimes none at all, ever. Yet they still transmit the disease. The number of people in the population of, e.g., Chicago, Cook County, or the state of Illinois is like the rocket's fuel. Each person transmits the disease to many others, and so the liftoff of the epidemic grows far faster than a rocket gathering speed. If this were not hard enough, consider that there was and still is a shortage of testing kits. So we could not even see the disease properly and still can only guess at how many individuals have been infected and remain infectious today. But it's even worse than this. The laws that govern the trajectory of a rocket were discovered by Sir Isaac Newton nearly 400 years ago, but the precise laws that govern the trajectory of an epidemic are still unknown and depend on the behavior of people. By heeding the governor's stay-at-home order, the population of Illinois has dramatically altered the trajectory of the epidemic in ways that we had hoped for but could not precisely predict. The epidemic is like a rocket that you can move by mind control. It's not rocket science. It's harder. The only way to see COVID-19 is through mathematics. For this reason, the governor set up a community forum to coordinate and compare the modeling efforts of 3 groups within Illinois. In addition to our group from the University of Illinois, there is one from the University of Chicago, headed by Professor Seri Kobe, and another from Northwestern University, headed by Professor Jalene Gerardin. Professors Kobe and Gerardin are epidemiologists by training. We happen to be theoretical physicists with backgrounds in modeling ecosystems, bacteria, and viruses. Our group is small, but its members, whose expertise ranges from black holes, cosmology, material science, and engineering, are experts in computation and modeling. The modeling challenges posed by COVID-19 are extreme, requiring simulating many thousands of scenarios, calibrating models to data, and many hours of discussion about the results and their possible errors. We are comparing our results in a double-blind way. We can't do peer review because there's not enough time. So what we hope to achieve is consensus on the main trends and take-home messages, not exact agreement about numbers. We are assisted in this community forum by Civis Analytics, who have helped us to get the required data, to compare the different team modeling efforts, and coordinate the presentation of results to public health officials and the governor's office. The novelty of COVID-19 means that there are many basic things about the virus we do not know, and so we can only make educated guesses as to how to include them in the modeling. The first unknown is so-called seasonal forcing. Everyone knows that influenza tends to be more of a problem in the winter than in the summer. The reasons for this are not agreed upon by epidemiologists, but everyone agrees that this seasonal effect occurs. We do not know if COVID-19 will fade out during the summer. Other coronaviruses do have a seasonal effect, and so we have assumed that COVID-19 will do so also. This means that our models, the Illinois models, University of Illinois models, predict that as we get into the summer months, COVID-19 will tend to be weaker and may even fade away completely. If we are wrong about this, then our predictions will be too optimistic. In models run by us and also by the University of Chicago, we have seen that removing the seasonal forcing effect will indeed make the predictions more pessimistic. And you can see that here on these 2 graphs, one showing the University of Illinois calculations with seasonal forcing, one showing the University of Chicago calculations without, more pessimistic as a result of that. However, if we are right about the seasonal forcing, there is still a downside, because it means that after the summer, the virus will start to become more effective and the COVID-19 epidemic will restart. The second unknown is that there can be people who get infected but never show symptoms. These asymptomatic individuals can potentially cause a problem because it would mean that there are more infectious people in the population than the models predict. This means that our scenarios for the relaxation and mitigation might underestimate the second wave that would be expected to start then. The presence of asymptomatic individuals could also help the scenarios because we could conceivably get more quickly to the point where the epidemic dies out naturally, so-called herd immunity. Some recent studies seem to point to a larger asymptomatic population than is revealed by the number of reported cases. However, don't be fooled. They still, even if true, they still lead to a prevalence of individuals who were ever infected of about 3%, which is far smaller than what is needed to get to the state of herd immunity. And that is why it is very important that you wear a mask, that we all wear masks, whenever you are not at home. The third unknown is that we do not actually know if one is immune after one has been infected. If this is not the case, then our models will be underestimating the progression of the epidemic. You might wonder why the state of Illinois needs such a vigorous modeling effort. Aren't there huge modeling efforts being undertaken elsewhere by larger groups with more funding and staff? The answer is yes. There are such efforts, but we do not feel that such efforts are as sound scientifically as what we're trying to do here by having a consensus of different models. And we can better focus on the needs of the people of Illinois, for example, by providing predictions and advice for the regions of the state beyond the Chicago metropolitan area, and for the hospitals as well. So now let me turn over the podium to my colleague Sergei Maslov, who will now describe what we have learned in detail from these models. Thank you.
We were asked by the governor's team to consider 3 different scenarios. One in which stay-at-home order was never issued, another one in which it was issued and maintained for the whole duration of the simulation, and the third scenario in which the stay-at-home order was initially issued but then relaxed after April 24th. This sort of what-if exercise is impossible with curve-fitting models because they cannot account for events that did not actually happen. However, our mechanistic models considered by the 3 groups gathered by the university, by the government of Illinois, allow us to turn on or off the effects of social distancing and to figure out how the social distancing affects the trajectory of COVID-19 epidemic in Illinois. By looking at what would have happened if the stay-at-home order has not been issued, we can estimate how many lives the people of Illinois have saved just by staying at home. As was noted by Professor Emily Landon right here at this podium when the stay-at-home order was first announced, the success of social distancing is measured by what did not happen. Our calculations show that the number of deaths would have been about 20 times as high as they are today. That means that we would have seen as much as 30,000 deaths or more by this time in the epidemic if the social distancing measures had not been practiced by population of our state. At the time of the stay-at-home order, the number of cases in Illinois doubled every 2.5 days. Growth at this rate would have quickly brought the number of sick patients to exceed the state's capacity to take proper care of them. Thanks to governor's prompt actions to first close schools and then to issue the stay-at-home order, this did not happen. In addition, this action prevented the state health system from collapse. So what is happening in the real world right now? Our model suggests that because of the social distancing measures adopted by the people of Illinois, we are currently approaching the peak of the first wave of the epidemic. The number of hospital and ICU beds occupied by COVID-19 patients is currently within state's capacity, thanks to the fantastic work by the frontline healthcare workers. In fact, the number of beds that are occupied by COVID-19 patients has remained approximately constant over the past week and is not increasing. This is great news, but it's not the time we can really let our guard down. The reason is that once the peak is reached, it is not the end of the epidemic. There are still people dying and new cases being announced every day. But there is something else as well. Mathematical models are capable of seeing what we cannot see. They can predict the current number of infected individuals, which we cannot measure due to limited testing capacity of the whole country. The models predict that this number is at least 10 times larger than the number of new positive tests announced every day. Furthermore, it will remain high even after the peak of the epidemic. While there are so many infected individuals walking the streets and relaxing social distancing too early would start another wave of the epidemic. But unlike the first wave, which may have started from only a few individuals, the second wave would be started by thousands of infected people. When we simulated this scenario as requested by the governor's team, we saw a drastic rise in the number of hospital and ICU admissions and deaths. The second wave would quickly surpass the ability of our hospital system to respond. Let me summarize. In short, our models show that the prompt actions by the governor and by all of our population in Illinois prevented the healthcare disaster in Illinois. Our health system is coping now, but all these hard-won gains will be erased in a second wave of the epidemic. The second wave is certain to start if social distancing measures would be reduced prematurely. With this, let me turn the podium to Dr. Toyin Felusi, an infectious disease specialist from Rush University Medical Center.
Good afternoon. My name is Toyin Felusi Adeyemi, and I'm speaking today as an infectious disease physician who's been in practice for over 20 years. All of those years I practiced at Cook County Health, where outstanding care is provided to people from communities most disproportionately impacted by chronic health conditions, social and economic hardships, and now hit hard by COVID-19. While I'm no longer on hospital rounds, I remain connected to those on the front lines and in the emergency departments and hospitals who are working long, hard, challenging, strenuous hours each day, caring for people sick, many in the ICUs, many on ventilators with COVID-19. My colleagues, my physician colleagues and other healthcare workers, the residents and fellows in trainings, our advanced practice practitioners, and nurses, social workers, respiratory therapists, pharmacists, technicians, the lab techs, the radiology techs, nutrition, environmental services, transporters, security, clerks, all the people that are vital in keeping the hospitals going are stretched physically, mentally, emotionally, and many will have years, decades, or even a lifetime of trauma from their experiences being in the front lines during COVID-19 pandemic. This virus is brutal, it's scary. And COVID-19 has impacted us all. We've heard the numbers daily. We've heard about the people who have died from this disease. These are human beings and who have loved ones in their lives. Sad, extremely sad. Personally, many of us, myself included, know people who care about who have been infected with COVID-19, who are ill with the disease, or unfortunately have died of COVID-19. Again, this virus is brutal, and we're finding out very protean in its manifestations. As Illinoisans, we've seen and heard over the last week or so that while new COVID cases and deaths are reported daily, including in healthcare workers, that the state of Illinois is starting to bend the curve. We're clearly, as you've heard, changing the trajectory of where things could have been much worse if we did not shelter in place and stay at home. But we definitely cannot relax now. Bending the curve, that has been stated, is thanks to all of you who have sheltered in place, socially and physically distanced, masked while you were outside, washing your hands obsessively, and staying the course during this difficult, frustrating, challenging time, but staying the course as it has been. As an infectious disease doctor who's done work in HIV and hepatitis and sexual health for 2 decades, I understand the power of prevention. As our clinicians and researchers continue to work on best management practices, conduct clinical trials of existing and new medications, as the NIH defines strategies for research priorities, as we work on new testing methodologies, including rapid diagnostics, as we look at critical vaccine development, while all of these things are critical and important, we need to continue to do our part to slow down new COVID-19 infections by staying home. Sheltering in place and staying home is our thank you to all essential workers who are out there keeping things going. Sheltering in place is our thank you, we appreciate you, to all the healthcare workers who leave their homes and show up in the hospitals every single day to care for those who are sick enough to be in the hospital. Stopping these very effective community mitigation strategies, these non-pharmaceutical interventions that seem trivial, if we set those back, things like hand washing, disinfecting shared surfaces, wearing your mask when you're outside, staying at home. If we discontinue those effective strategies prematurely, there will be a major setback, and that will cost us lives. That will overwhelm the health system, both directly and indirectly, and it will impact deaths not just from COVID, but from non-COVID deaths later on through delays in access for other people with chronic medical conditions, and will lead to an implosion of our existing health systems. There is only so much the healthcare workers can do with a second wave. So we know from the state that we still need to continue to increase our testing numbers. We need to increase our access, especially to communities that are especially hard hit. We need to effectively and efficiently trace contacts and isolate properly. We need to make sure that we have all the PPEs that we need in order to get to where we can begin to systematically and strategically reopen parts of our economy. We're not there yet. The science and the data tell us that. Effectively, we're not there yet. The city and state health departments and the government have been using very sound data, some of which you heard today and saw today, to guide these very important and difficult decisions. We need to trust our outstanding health officials and continue physical distancing and shelter in place until our numbers tell us that we can relax these restrictions. We've come too far, achieved too much to undo our progress, and we know that timing is everything. As you've heard, it may not be perfect, but we want it to be as close as perfect as possible. We've seen nationally the impact of time. We've seen the impact of delays in testing, delays in access, delays in getting enough PPEs, delays in closing down cities on COVID-19. The same way we will see the consequences of too premature opening on the impact of COVID-19. So again, the timing has to be right. As an ID doctor, who has my county volunteer badge and ready to help when needed, and a proud Oak Park resident for 26 years. I urge you to continue to take this seriously and stay home. This virus is brutal. I can't say that enough. On behalf of my colleagues and other healthcare workers at Cook County Health and other hospitals across the state, I implore you to show your appreciation for their dedication by staying home, continuing these strategies that have worked. Wearing your mask when you're in public, staying home, physical distancing. Prevention is powerful, and by staying home, you have and will continue to directly and indirectly save lives of people you care about, people you may not know, the vulnerable in our society, our essential workers, members of the healthcare workforce, and other fellow Illinoisans. So with that, I conclude by saying, please stay safe, stay healthy, stay home. And with that, I would like to introduce Brad Cole from the Illinois Municipal League, IML.
Thank you, Doctor. I'm here today, again, on behalf of the cities, villages, and towns of this state, all represented by the Illinois Municipal League, and all committed to stopping the spread of the disease that has created this public health crisis. Governor, as you and all of us know, this crisis and its condition has evolved in many ways during recent weeks. The individuals who have been sick or who have confirmed cases now are obviously and considerably anxious. We wish all of them a fast and full recovery. For those who have lost family or friends or even acquaintances, their grief is heavy, and we offer our heartfelt sympathies. This has been difficult, very difficult, and it will remain difficult, and more so, with this extension of the stay-at-home order. Everyday lives have been disrupted. Schools are no longer in session, businesses have closed, and many may not reopen. Jobs have been lost, and our long-term economy is in danger. The very fabric of our society is being tested in ways that we haven't seen since the last World War, and maybe even before that. But lives have also been saved. All of this is happening in the communities that make this a great state, communities of all sizes and all kinds. The mayors and local officials of those communities are pressed hard by their constituents for answers about what's going on and what's going to happen. Like everyone, however, we don't have all of those answers, In fact, we have just as many questions as anyone else. Municipal officials, law enforcement agencies, public safety personnel have been caught in the middle of disputes and disagreements. Those disagreements have included determining what an essential business is and what is not. And they've included protecting people's rights to protest peacefully against the actions of their government. This has been difficult. Municipal operations have continued when and where possible. We have worked to keep neighborhoods safe, businesses secure, and basic services functioning as residents expect and require. We have asked for compliance when enforcing the parameters of the executive orders, and people have been understanding. But this too has been difficult. I say all of this because sometimes we need to state the obvious. But in recognizing how obviously difficult things have been for every person and every community, we also have to state how obviously difficult things could be if we don't get this virus under control. As I have said before, the faster we comply with these temporary restrictions, the faster we will be able to stop the spread of this disease, and the faster we will be able to regain our way of life. This is a diverse state in many ways. The communities within it are even more diverse. This crisis has affected those communities differently, as impacted by the illness, some by geography, some by demographics, some severely and some not at all. But it has affected them equally in its economic and social impact, and that has not been pleasant. All of that considered, we stand together to resolve this crisis and to emerge from it better and stronger and more unified than before. Local officials understand their duty and responsibility to support the greater good, to uniformly enforce the restrictions that are or will be in place. That too will be difficult for those less impacted by the illness and for those who disagree with these decisions as a matter of public policy. But we are bound by our obligation to the residents of our communities, and we will see this through successfully for the benefit of our state and nation. Our commitment to provide for the health, safety, and welfare of our residents will not be diminished or challenged. We stand with you in fulfilling that pledge, Governor. As I have also said before, Illinois is a world-class state that is home to world-class cities that are home to the finest people we know. That is something this situation cannot and will not change. Thank you, and Governor, we'll return it to you for questions.
Thank you. Thank you. Happy to take any questions from
Hi, Governor. Patrick Elwood, WGN-TV.
Patrick.
Good to see you, your colleagues, and your guests today.
Thank you.
As it relates to moving forward May 1st and the hospitals and surgery centers, are you saying that doctors and patients can now start making appointments to do procedures beginning May 1st, such as MRIs, mammograms, colonoscopies, and other potentially life-saving measures?
I'm going to ask Dr. Ezike to come up and describe that to you.
So yes, we've been working very hard to try to come up with, very safe ways that we can help these postponed procedures and surgeries, which after postponing them for too long could actually become more of a harm to the patients instead of a benefit. And so we will roll out details in the coming days, but we are trying to make healthcare more accessible, these specific surgeries and procedures. And we'll be working with our partners, the Illinois Health and Hospital Association, to try to find the best medium in terms of keeping beds available for COVID patients in case there is the surge, in case there's any change in what happens with that, and make sure that we won't undo any of the benefits that we've done so far.
Governor, on the subject of the phase-in moving forward as it relates to parks and certain businesses, how are you going to handle that? Is that going to be a week-by-week assessment? Or in your words, what are you thinking as of today?
So the things that I enumerated a few minutes ago in my remarks are going to be starting up on May 1. The things that I enumerated, for example, retail establishments being able to do pickup and delivery of items. Those establishments didn't have that ability under the prior executive order, just as one example. In terms of the other phases that people are looking to, or the, as the president's plan says, phase 1 and phase 2 and phase 3 and so on, that, as you know, is dictated to a large degree by what was suggested in that plan. I think Dr. Fauci had a lot to do with that plan, and it sort of settles on the idea that once you get past a peak, which really can only be seen in the rearview mirror, because as we've said, these projections are only that, projections. But once you get past a peak and you have 14 days of reduction in the numbers as we talk about them, then we'll be able to move to make decisions about another phase. And so, that's the progression in terms of timing, and then the decision making about what happens in each of those phases. We're working on that as we go, talking with industry leaders, talking with the workers in those industries, and of course thinking about the customers if they're open to retail, for example, and then of course epidemiologists and doctors weighing in on the plans for those businesses going forward.
I'd like to ask you some questions from my colleagues in the city and throughout the state, please. Greg Bishop from the centersquare.com asks, the state is scheduled to give union workers $261 million in raises. How do you justify those raises to people who are out of work and struggling to file unemployment benefits and pay their daily bills?
Yeah. So as you know, these were, contracts negotiated after 4 years of no contracts for those workers and no raises at all. And so that's why those contracts are in place now. I was able to negotiate something with them. We certainly keep in close contact. We're watching the budget very closely, but suffice to say that, that's the reason that those exist. They're on a, if you look at the 4 years of no raises and the, the negotiated raises that were in those contracts, they're, very reasonable for the taxpayers. And I think, we're looking at all the constraints of the budget going forward, and, we'll continue to make changes to the budget, because that's something that, the February budget that was proposed is no longer a budget that we can ever follow.
So that $261 million could be readjusted?
It's a contract that was signed with those workers. So, that's not something that we're currently having discussions about. But my point is that as we look at the entire budget, and I said this before, that we're making sure that we're going to be able to meet our obligations, hopefully with support from the federal government.
Thank you. Marianne Ahern from NBC5 asks on behalf of a viewer, in the middle of June, they are hosting a wedding ceremony, a reception at a Bolingbrook Country Club. Would you consider easing the number of people who can gather at group settings beginning June 1st, and then would that apply to graduations as well?
Well, again, we're looking at everything for the next phase. That would be during a next phase. This executive order runs through May 30, so we'll certainly look at everything and very importantly, we'll look at the numbers and the way the curve is moving and make sure that we've got the proper bed availability in our hospitals, and that we are able to keep the infection rate down, and we'll have to watch it as we go.
Very good. This next question is for Dr. Ezike. And this is asked by Vanessa Navarrete from Univision. She wants to know if you are aware of the results of a study that was put out today that found that COVID-19 has spread through air conditioning systems at a restaurant in China.
I am not aware of that, but I will make sure that my team researches that so that we can be aware of all the current information that's coming out. So thank you for sharing that.
You're very welcome. Governor, this is from Tiffany Lupensky. CBS.com. She wants to know on behalf of WBBM, if you haven't already addressed this, but what are your thoughts about the recommendations concerning the letter that Minority Leader Jim Durkin put out today, expressing his desire for you to share the modeling numbers in detail with legislative leaders as well as the public?
Well, I think one of the purposes of today, he and one of his colleagues in the House have wanted to see the models. And, as I've said to them many times, there are multiple models, and the modeling doesn't determine my answers to, how we're going to move forward, but it is instructive for sure. So this is an assistance, I think, to everybody to understand what we're looking at. But this isn't even the only thing that I'm looking at. So the idea that somehow sharing one model with people is going to somehow instruct them about what next moves we're going to make, I think is a fallacy.
Do you share that information in detail with legislative leaders presently?
We today, again, we put out this information. They now know who all of the people are in the institutions. I think those folks have, on frequent occasions, spoken with the media about modeling, and I'm sure that they would continue to share their thoughts.
Mark Maxwell, Capitol Bureau Chief, asks that we are nearly 5 weeks into this stay-at-home order. COVID-19's incubation period is 14 days. You have acknowledged most people have done a great job complying. Our families or friends who have followed the rules and remained symptom-free now able to meet in smaller groups, closed circles, is how he refers it to.
I'd like to refer this to Dr. Zike because she will have a better answer, but I'll just start by saying that this virus is still out there, that if you are no longer obeying the recommendations that have been made and the orders that have been put in place, you're simply opening yourself up and everybody else up to infection. But I will turn it over to Dr. Zike.
Again, the small groups that form like a household or a nuclear unit, those are the groups that we've asked to continue to stay together. If you increase that group beyond your nuclear unit, and then someone else from that group now has a small gathering with someone else, the power of exponential growth is still there. And I just remind everyone that one person infecting 3 people, and those 3 affecting 3 each, you get, with just 10 rounds, you get to 59,000 people infected. That is how quickly, and that's why the models initially without the interventions would have put us beyond our healthcare capacity. So we still have the enemy out there. We've done great, but we haven't quelled the virus by any stretch. We still have no treatment. We still have no vaccine, and we don't think we have an acceptable level of herd immunity. So again, to not undo the great work that is done, we probably need to do the same measures.
Governor, this is from Eric Hong from ABC 7. He asked, you have been accused by some, including some Illinois Republican lawmakers, of operating in a bubble. Would you commit to holding a virtual town hall to hear directly from Illinois residents about the economic problems that they are facing?
Well, the accusation that I'm operating in a bubble is ridiculous. First of all, I think everybody on my staff and the Republican members of the House and Senate and the leaders themselves know that I make frequent calls every day to them, to many of their constituents, to mayors. I know Brad Cole knows there are quite a number of mayors all across the state that I've reached out to. I've tried to make myself accessible in every way that I can. We're also in a stay-at-home order. I'm trying hard to reach out, as we all are, using Zoom and other methods of communication with people, and I'll continue to do that for as long as we're in this situation.
Thank you, Governor. Amy Jacobson from WIND Radio says that, preface it by saying this, Mitch McConnell has said he won't provide federal bailout funds for state pension funds, but he would support a provision to allow states to file for bankruptcy. You have said you don't want such a provision and wouldn't use it. If a reorganization was good enough for Puerto Rico with less debt per capita than Illinois, why isn't it good enough for Illinois? And if it's not good enough for Illinois, what options would you necessarily consider absent a federal bailout?
So I would like to say that Amy clearly doesn't understand what happens when an organization goes through a bankruptcy and out the other side. The cost of borrowing, the cost of doing business goes way up. Much beyond where we are now. We would be paying interest at usurious rates. our state would be in a world of hurt. People wouldn't want to do business, in fact, with a state that's gone through bankruptcy, with the idea that, well, if you've gone through it once, you might go through it again. And the fact is, states are not allowed to declare bankruptcy, and it's a good thing. What we do need to do is make sure that we do, as I was doing before we got to this crisis, which is to balance our budget on a regular basis, to begin to build surpluses so that we can pay down existing bills that were there before I came into office, to make sure that we're continuing the services that people need in the state while also being fiscally responsible.
Thank you, Governor. Cisco Cotto from WBBM News Radio asks, there are several downstate counties that are being devastated economically, even though they have very few infections. Why not allow those areas to reopen across the board?
Well, as you can see from some of the changes that we made in the executive order, I listened to many people downstate and in areas where there were lower infection rates, lower hospitalizations, so that we could make it more accessible for them to do certain kinds of things that we thought will not spread the infection, but will allow areas that have a different set of characteristics than, let's say, an area of downtown Chicago, to be able to operate in a different fashion. So that's built in. I talked about some of those things in my remarks.
Thank you, sir. One additional question. This is from Elizabeth Matthews from Fox 32. It's either for you or Dr. Ezike. She asked that a study finds that 88% of COVID-19 patients who were on ventilators in New York passed away. Do you know what the percentage is here in Illinois?
I have been following more national and international data. I don't have Illinois-specific data, but across the board, we have seen rates of 50 to 80% mortality on vents, and we have learned, I know from talking to ICU and pulmonary specialists, that people are trying different, more innovative ways to try to increase the oxygenation in patients who are suffering respiratory distress, and that involves putting people on their stomach and rotating them in the different positions to try to get oxygen to different parts of the lung. So we are seeing that here, and appreciating all these pulmonary intensivists who are trying to find new ways to care for this very serious disease.
And I know it's odd for a non-doctor to add to that answer, but I'll just say that it's been, as many of you have heard, I've focused a lot on making sure that we have enough ventilators for people in the state. During the time period when we've been focused on this, doctors learning more about the effects of COVID-19 have learned that there are other therapies that they can bring to bear, like what Dr. Ezike is talking about, to lessen the likelihood that someone will end up on a ventilator. And it has been successful. Not universally so, but it's been successful. And the result is the need for ventilators has come down since we first looked at what are the resources that we need to meet the challenge of the curve. Thank you very much, Patrick.
Okay, we'll switch to questions from reporters not in the room. This is from Hannah at the Daily Line. How much testing do we need in Illinois in order to go about normal life before a vaccine is widely available? What's the figure in terms of tests per capita? Have we hit a ceiling in our ability to test in the nation or in Illinois because of a lack of testing materials available? What about the spread of the disease in Illinois? Do we not know yet because of this?
Multiple questions in there. Hopefully you'll remind me whatever I've forgotten. But let me start by answering the question about how many tests do we need per capita, what's the right number. It's very difficult to say, and the reason, when you talk to the experts around the country about this, they will give you different answers. And it is certainly different in different industries. Obviously, what you'd like to do in certain industries, like the nursing home industry, is you would like to be able to test every person every day on a rapid test basis. So that's, add all of that up, and that's some number of tests that you start with. And that's just nursing homes. We want to do that in each setting in where you've got somebody who has a comorbidity that might put them at risk. So that's why nobody's really come up with quite the exact number. What I can tell you is, as you know, I set an initial goal here for Illinois, because remember, when I set the goal, we were only in the few thousands range of testing. I set an initial goal of, let's get to 10,000. That seemed like a pretty big number, and it still is. We aren't there yet, but we're getting closer. And then the question, and I'm certainly thinking about this too, what's the next goal? We're not going to be able to immediately go from 10,000 to 250,000. So what's the next goal? What's possible? And how would we use the tests if we could come up with a number that's possible in the near future, over the next, let's say, the 2 months hence? How would you use those tests, right, if you came up with that number? So that's how we're operating now, because the truth is, even if you set a goal of hundreds of thousands of tests a day, the testing materials don't exist today because the market is so strained. And so it's difficult to try to shoot for the moon. But I do think, setting real goals that are, a little bit slightly out of range that you can shoot for and work really hard to make, those are the kinds of goals I like to set.
This is from Tina at the Sun-Times. Why is Cook County seeing a different range of deaths and cases than other cities with similar demographics? What factors are you seeing to suggest why the county is not recovering as quickly as other similar counties? Those were for some of our modeling
I
experts.
think I'd like to turn it over to, maybe
Or
the
Dr.
modeling experts or Dr. Ezike could start, yeah.
So I think, as we've said many times before, this virus is preying on people who are older. It's preying on people with underlying conditions. So there's definitely a bias towards communities or areas where there are older people or more infirmed people. It's one of the reasons that we have seen the health disparities across our ethnic groups, with the Black community bearing a higher burden of this disease in terms of the mortality. Again, the disparities of health in terms of the health of communities existed before COVID was here. Again, we've talked about many of the reasons for that: socioeconomic, racism, many, loss of opportunities. But if you had that to start with, and then you place COVID on top of that, then you will have a more serious burden of the disease on those communities.
This is from Jamie Monks of the Tribune. How will the face covering requirement be enforced? And with the stay-at-home order now in place for over a month outside of congregate settings, have you identified where community transmission is continuing to happen?
Face coverings, the same way that everything else has been enforced. It's certainly done at the local level. We're not encouraging police officers to stop people and to arrest them or take drastic action. We are encouraging certainly everybody to encourage everybody else that they know, but including the police or other officials, to people should wear a mask, and they should be reminded if they're not wearing a mask that they're not. And private establishments do need to require that people who enter their establishment wear a mask.
Kelly at Block Club.
I'm sorry, there was a second half of Jamie Monks's question, if you can remind me.
Where are we seeing community transmission and continuing to happen?
I think I'd like to turn it over to Dr. Ezike for that.
We have community transmission in all parts of our state. I think in terms of documented cases, we're at 96 cases of the 102. And so we know that the majority of people who are ill cannot tell you exactly where it came from. So there's widespread community transmission. You could say that the rates are higher in some areas than others, but that's not to say that we don't have it throughout the state.
And let me just remind you that you need to do more testing everywhere in the country to do sentinel surveillance, which is what would answer that question better. But Dr. Ezike has it right. It is everywhere. Where is there an outbreak? Everywhere. I realize that in some areas of the state we have fewer people who have tested positive and fewer people who have passed away, but that does not mean that it is not in your county or in your town.
This is from Kelly at Block Club. What will the state do to help people unable to pay their rent or mortgages? Many won't be able to pay at the end of forbearance periods since they've gone without income.
Yeah, and you know that we've been encouraging the forbearance as much as possible. We've obviously stopped sheriffs from evicting people. We've talked to mortgage companies to get them to provide forbearance. Look, we're all hopeful that we're able to begin to put our economy back together. We hope that the forbearance period that people will be able to take advantage of will be a short enough period but fully covered so that when people are able to go back to work, they'll be able to afford to pay their bills.
Greg Hines at Cranes, you are allowing outdoor recreation. Why not indoor pools, which are chlorinated, or gyms under correct spacing and capacity limits? Isn't that a health necessity for some people?
Which doctor would like to talk about swimming pools?
You know, IDPH does regulate pools, and if we want to get into the different microbes that exist within pools, different swimming pools, we can do that. But definitely, the practice of obviously being in a swimming pool, unfortunately, we do know that there is some fecal shedding of the coronavirus, if I can go ahead and share that. And so as well as associated with pools, you would have locker rooms with which people would need to change. So you would have more people congregated in the same setting. So for a myriad of reasons, that wouldn't be conducive to promoting social distancing and decreasing community spread.
This is from Amanda Vinicky at WTTW. Will you release the raw data for these models? When and where can we access it?
So I just want to be clear with everybody, we don't own these models. These models belong to the experts who you've heard from and the others who've been part of our consultative group. And so I would suggest, I will just remind everybody that they have spoken with the press before. They've been quoted about what the work that they do, and I think that will continue. And so, again, it's up to them, though. These are models that are owned and controlled by the people who created them.
Pete McMurray at WGN Radio, boating with 2 or more people will be accepted after May 1. How do we police boating on Lake Michigan?
2 people, 2 or less people. And so we, they're just the same way. Look, we're encouraging everybody to do the right thing. I think, that we're not going to be sending police out to look at every boat and count people that are on the boat. But I think people know what the right thing to do is. They're being told what the right thing to do is. And if it needs ultimately to be enforced, then we may need to go that direction by using law enforcement. But that is not currently what we're looking for.
John O'Connor at the AP. Many retailers already fill online orders and do curbside business. How will this benefit them beyond what they're already doing and sacrificing?
Well, if they're not an essential business, they will not have been doing this or should not have been doing this, but it is now allowed for retail businesses.
Matt Roy at WICS in Springfield. What is the status of Vibra Hospital in Springfield?
It has been identified certainly as a surge capacity alternative care facility. No work has yet been done on Vibra Hospital, and we're certainly evaluating and hopeful that we won't need to build out more facilities, or that we won't need to use, and light up all the facilities that we may have because it is very expensive, as you can imagine, to staff these even on a temporary basis, but necessary if there is a requirement for surge capacity, because the existing hospitals wouldn't be able to handle that surge.
Ed at the Sun-Times, the stay-at-home order has now been in effect 33 days, and yet we've had a record number of new cases yesterday. Is this simply a result of more testing, or is the virus continuing to spread? If it's still spreading, do we know where and why?
Dr. Zike?
I will say that the increased number of cases have to be taken in context with what the denominator is. And so, as you've heard Governor Pritzker say, the last 2 days we've tested over 9,000 people for the first time in the state. And so, when you look at the numerator, the number of positive cases, over the denominator, all the people that were tested, we actually are still running about the same percentage of positivity. But obviously, if you test more people, you will get more positives. Again, that is understood, but I think we're still in the 21% positive rate, so it's still consistent. It's just a matter of more people tested.
Jake Griffin at the Daily Herald. Many people in rural parts of the state want to quarantine Chicago and the suburbs and reopen parts of downstate Illinois that aren't seeing infection rates like the urban areas. Why has the state not done
that? I'm not sure how to answer that, except that this virus knows no boundaries, folks. No one is immune from this virus, no matter where you live. And we are trying to take into account the differences between population density in one area of the state versus another. And you're seeing that in the executive order, the modifications to the executive order that we put out today.
Shruti at Bloomberg, was the extension of the stay-at-home order on May 30th taken into account when you gave your updated budget and revenue figures for fiscal year 2020 and 2021 last week? If not, given large parts of the economy will still be closed for 4 more weeks, do you expect revenue coming into the state this and next year to be even lower than the drop you projected last week?
There are unknowns every single day, and so no, I didn't know, a week or 2 or 3 ago what exactly we would be doing in the month of May, nor do I know honestly what's going to happen tomorrow as a result of this virus. But what I can tell you is that we have taken into account the fact that there is a significant effect on the state of Illinois' economy and therefore on the collection of tax revenue for the state. And so, we have projected that this would be a prolonged recession, not multi-years, but a reasonably long one. And so that is factored into the numbers that we put forward. And we'll continue to evaluate that as we're working with the legislature on putting our budget together.
Shia from Politico, can you explain specifically what kind of economic relief you've asked for from the federal government?
Well, I have been involved in asking for relief for hospitals, for unemployment, for those who are unemployed, making sure that we provide funding for our local governments. One of the challenges of the last CARES Act was that it set a threshold at 500,000 people. So if you were in a city or a town or a county that had less than 500,000 people, you weren't benefiting at least from that provision of the CARES Act. And so that's one of the things that I've talked about. Smaller cities and towns and counties should be able to benefit too. And of course, the states are, have undergone, significant pain in their budgets. And it's not just the state of Illinois, it's every state in the United States. I was on a call with the National Governors Association members, all the governors, or at least as many as were on. I think there were 40. As well as numerous other direct calls that I've made. Everybody, Republican and Democrat. There are 24 states led by Democrats, 26 states led by Republicans. Every one of the states is having the challenges that we're having and needs help from the federal government. So I talk to federal representatives or have my team talking to federal representatives all the time. And I hope that each of the provisions that we've talked about, small businesses need more relief. There's no doubt about it. And so small businesses, hospitals, all of these things I've taken into account and I've lobbied for to our federal representatives.
This will be our last question. Tiffany at Tribe. I see the number of drive-through testing sites are expanding, which is great, but how would they recommend residents who rely on CTA and don't have access to a car access these test sites since they are mostly located in surrounding suburbs?
Yeah, well, people who don't have a car and take the CTA, there are many, many more sites available to them. Actually, these drive-through sites are convenient and safe for people who do happen to have a car, but FQHCs, federally qualified healthcare centers are available all across the state of Illinois. We had a press conference with the leaders of the organization that represents them, and in fact, if you go to the IDPH website, or just go to coronavirus.illinois.gov. You can find a map of where all of the testing sites are, and we're adding to them all the time now because we are increasing our testing capability in the state as we are on our own acquiring all of the supplies that are necessary and making sure that those sites have those supplies.
All right, thank you, everyone.
Governor, may I have one additional question, please?
Thank you. Go ahead, Patrick.
New York Governor Cuomo had a meeting in the White House a couple of days ago with the president and his team. Would you be open to a similar move, while you've been a big critic of the president and what he has done in his administration? Would you be willing to meet with him at the White House to help mend fences and get your point across directly?
Of course, and I've been on the phone with the White House on frequent occasions. I've spoken with the president and the vice president all during this crisis, even when the president has been critical of me. I'm somebody who will do anything to work for the people of the state of Illinois, anything to help us get back on our feet and to get past this crisis in a way that preserves our working families and helps them. So, yeah, of course. I mean, I would do any of those things. The president does not, I have been to the White House and met with the president at the White House on a couple of occasions now during the course of my governorship. And of course, I would go back, and Vice President Pence, who was a governor of a neighboring state, Indiana, has been very communicative with me. And I know that he would also, have a meeting with me if I asked for one. So, yeah, absolutely. Thank you.
Thanks for watching, and if you haven't already, please consider subscribing to our channel. And while you're at it, please leave us a comment. Thank you for watching.